So one of the more challenging things that surgical technology students have to learn is all the instruments that go along with all the surgeries. There are hundreds and hundreds of instruments that as a surgical technology student you're going to have to learn. Today I'm just going to cover the 50 or so most basic instruments, those instruments that are going to be used in many different surgeries. So we consider these the basic instruments, and we're just going to go very briefly through them, give you a quick introduction to each of these instruments and how they're used. So probably one of the most commonly used items is going to be the Bovie, or the electrosurgical unit. Now this is the handpiece that comes, this is a disposable unit. It is attached to a giant contraption. We call it the Bovie, or the electrical surgical unit, that actually powers this. Now the electrosurgical unit is used to provide a little jolt of electricity to the tissue that we're working on. Now it can do one of two things. One, it can cut the tissue. Basically what it's going to do is that electricity is going to cause that tissue to get so hot it vaporizes away and it causes it to cut through that tissue. Or it can cause it to coagulate. Now what this means is you're going to take that tissue, heat it up a little bit in a specific way. It's going to cause the proteins in that tissue to sort of liquefy a little bit and then come together, to congeal together, to coagulate, and that's going to seal off any little blood vessels in that area, and it's going to cause the bleeding, any bleeding that might be in that area, to stop. So we use the electrocautery unit, and the electrocautery pencil in this case, to touch where we want to either cut or coagulate, to stop bleeding in the wound. This is used in conjunction with a grounding pad that we're going to place elsewhere on the patient. This is going to complete the circuit so that we have an electrical circuit that runs from the tip of this ESU pencil through the grounding pad and then back to the power unit itself. The electrodes itself, the tips of these pencils, are interchangeable. So this is a standard one. Now with this one, what'll happen is as you're burning through or coagulating the tissue, some of it can sort of stick to the end of it. It gets kind of charred a little bit. You have to brush it off. Or you can swap it out with a Teflon coated tip, and this Teflon coated tip is nice and slippery, so you can just sort of wipe, using a Raytech, you can wipe any charred tissue that might be stuck on there off. These also come in different sizes. You can come with the really long ones that'll help you get nice and deep into a deeper wound. So these longer ESU tips are possible as well. Now another way of cutting and coagulating tissue is using a harmonic scalpel. This guy's kind of fancy. This thing plugs into a power source, and what it does is it uses electricity to create a very high frequency ultrasonic vibration in this piece that runs down the length here. So at this end, we're not using electricity at this end. At this end, one of the pieces is vibrating very quickly against the other piece. So it's sort of doing this. It's vibrating very quickly. It's creating a lot of friction. That friction then creates heat, and it cuts through and coagulates the tissue. So when we close down on this, you can see the one end is going to vibrate very, very quickly. The other end squeezes that, and as it does, it creates that friction in there that's going to cut and coagulate any tissue that we happen to clamp through this. But when it comes to clamps, there are many different types of clamps. These are small clamps. We call these mosquitoes. The technical name is the Halsted clamp. There is a curved and there is a straight version of the mosquito clamp. So it's just a small hemostat. Now the curved version, usually you're going to use curved versions of these instruments on tissue. So if you have a very small bleeder or something like that, you can clamp that, and that's going to stop the bleeding. Now the straight versions are usually used on things like dressings or suture. In fact, you can get these little suture boots. We call them suture boots, little rubber covers that fit on top of the mosquito, and that very delicately holds onto some very delicate suture. So you can use the mosquito, the curved mosquito here in this case, to hold some delicate suture. But the mosquitoes are one of the smallest clamps that we have. The next size up is the Cryol. This is a very common instrument, also called a hemostat or a snap. Now the Cryol also comes in a curved version and a straight version. The curved version, again, used on tissue in general, usually to clamp down onto some blood vessels that might be bleeding. The straight version used to maybe pick up some dressings or, again, suture, other things like that. It's the curved version that'll be mostly used on tissue, and it's this version that you'll most often hand to your doctor. Now notice the size difference between the Cryle and the Mosquito. The Mosquito is just slightly smaller than the Cryle, but it's otherwise essentially it's the same instrument. Now very similar to the Cryle is the Kelly clamp. It's just a little bit bigger than the Cryle. And there's one other difference here. And if you look at the serrations inside there, you can see that the Cryle, the serrations on the Cryle go all the way down to the box lock, whereas the serrations on the Kelly only go about halfway down. That's the defining difference between a Cryle and a Kelly, is that the serrations only go halfway down on a Kelly. Now slightly bigger than the Kelly, we have the Peen, also a curved clamp. This one has serrations that, like the Cryle, goes all the way down to the box lock. Again, the Kelly is the only one where it only goes halfway. The Peen is slightly larger. On the East Coast, east of the Mississippi, we usually pronounce this Peen, P-E-A-N. That's how it's spelled. It's sort of like a bean, like a can of beans. Okay, this is a Peen. Now on the West Coast or west of the Mississippi, they'll often pronounce this a peon, so you might hear that as well. But this is a Peen, at least on the East Coast. And then we have a slightly larger version of this. This I refer to as the Rochester Peen. This is a larger version of the Peen. This is the Peen here. So you can see compared to the Kelly, the Peen, and then the Rochester Peen, they all sort of grow slightly in size. So the Rochester is the larger version of the Peen. Now two other clamping instruments that we have the Schnitt and the Mixter. Now the Schnitt is like a very long-handled Cryle, and this is usually used, this is often called the tonsil Schnitt, so it's used for tonsil procedures, things like that, because it can reach deeper into the mouth. But it's a clamp. It can clamp down on the tissue either to control bleeding or just to grab the tissue and pull it out. So this is the Schnitt. Now the Schnitt, like all the other clamps that we've seen so far, has a very gentle curve to it. Now the Mixter has a sharper curve, almost a right angle curve, so this is often called the right angle clamp. Now scissors are important when it comes to surgery, and one of the most popular scissors is the Mayo scissors. This is a nice, big, heavy, bulky scissors, kind of like the kind you might find in your kitchen or in your, your desk drawer or something like that. Now these scissors are straight, so this is the straight Mayo, and this, again, we like those curves. This is the curved Mayo scissor. Now, why the two versions? Why a curved and a straight version? Well, usually during surgery, we're working in a very tiny opening, and we sort of have to put the instrument in through that tiny opening, and we're looking at whatever we're trying to cut or clamp vertically through that opening in the same direction as our hand. So if we're doing that with a pair of straight scissors, for example, well, our hand is in the way. We can't see what's going on. Whereas if we have a curve to that, now the curve sort of bends out a little bit and we can see past our hand exactly what it is that we're cutting or we're clamping. So if we like the curved ones for cutting tissue, well, what do we have the straight ones for? Well, the straight ones are actually used not often for tissue. This is used for cutting dressings or suture, something like that. So we have the straight ones for cutting suture and dressings and the curved ones for cutting tissue. Now sometimes we want a slightly more delicate pair of scissors, and that's where the Metzenbaum scissors come in. And this is a very delicate pair of scissors. It's again got that curved sweep to the blades there as it goes in and cuts the tissue. The Lister scissor, or the bandage scissor as it's sometimes called, the Lister scissor, it has an interesting shape to it. It's got a little tip that comes up and then a very soft rounded tip on this end. Now this is often used, say for example, during a C-section. As we go in and try to cut the uterus, what's going to happen is we're going to place this rounded tip in there into the uterus, and we cut the uterus open this way so that we're not going to be damaging the baby's head, which is going to be right underneath here. So we're going to cut the uterus this way and open it up using this protected Lister scissor. Another important cutting device is the wire cutter. This is sort of like a little pair of scissors, but they're actually tough enough to cut wire. Sometimes we'll send patients back after having their teeth wired or their mouth wired shut, but in case there's an issue, we'll send a pair of wire cutters with them so that the doctors can quickly cut that open if they need to intubate or get an airway created for that patient. But these will cut wire. These are nice tough scissors that can cut some nice thick wire. Now scissors aren't the only way to cut tissue. One of the more common ways is to use a scalpel, and we have a number of different scalpel or knife handles that we can load a scalpel blade onto. Now these knife handles come in a bunch of different varieties. We have the number 3, which is very common. It's used just about everywhere. We have a number 3 long, which is just a number 3 with a very long handle on it. We have the number 7, which is very similar to a number 3, except it's got a long, skinny handle. This lets us get a little bit deeper into certain wounds. We have a number 4. Now the number 4 is actually very similar to the number 3, except for the tip at the end. The difference is that the end of the number 4 is a larger tip, which means we're going to put larger blades onto it. And blades that are designed for the number 4 don't fit on the number 3 and vice versa. So let's take a look at a few of the blades. So we have a couple of the blades here. We have a number 10 blade, which is a very common blade. That's sort of your standard scalpel blade. And we have the number 20. Now notice the difference here. If you look at the difference, you can see that the 20 is larger and that the opening, the fenestration, the opening in that blade is larger, which means the 20 is going to fit on a number 4 handle because it's designed for that larger tip, whereas the number 10 is going to fit on the smaller number 3 handle. I know in a lot of numbers, they kind of get confusing, so you're going to have to remember the number 3 goes with the number 10 blade, the number 4 handle goes with the number 20 blade. And in fact, there's a whole series of blades. There you see the different tips on here. This one's a curved. This is a number 12. This is a number 11. It's got a pointed tip. It's good for making punctures. And then we have a small blade down here. This is the number 15. And all of these, the 10, the 11, the 12, and the 15, all of the 10 series numbers, they're going to fit onto your number 3 knife handle. Or alternately, they're going to fit onto the number 3 long or the number 7. So the number 3, the 3 long, and the 7 all have the same tip. So they're all going to handle the 10, 11, 12, and 15 blades. It's only the number 4 that has that larger tip that's going to handle the larger blades like the number 20. And there's a 22 and a 21 and a 25. So you have that 20 series, which are the larger blades. They're going to fit onto the larger tipped number 4 handle. Now for very delicate surgeries, like say plastic surgeries, you have what's called a beaver blade and a beaver handle. This is a beaver handle. It unscrews here, and this is like some of the X-Acto knives. If you do hobby work, you can take this very tiny, very delicate blade, which is a beaver blade, insert it in there, twist it up nice and tight, and hold it onto there, so you can do some very fine cutting with a beaver blade and a beaver blade handle. So now we move into forceps. Now I have a couple of forceps laid out here. Now these are not tweezers. We don't call these tweezers. We use the high class term. These are forceps. Sometimes you'll hear people call them pickups for, picking stuff up, but generally this is called a forceps. That's the official term for it. And there are a bunch of different designs to these. These are the most basic ones that you're going to see. So we have what I call a plain handled forceps. It's just sort of a typical handle. It's nothing fancy about that, versus an Adson handle. You can see the difference there. The plain handle is just sort of a nice straight handle, whereas the Adson handle is a little shorter and it's a little wider. What this does is it gives the doctor a little bit finer control in very small, delicate areas. So one thing that defines different forceps is the shape of the handle. It could be a plain handle or an Adson shaped handle. Now the next thing that distinguishes different forceps from each other are the tips. So the first type of Adson forceps has a very plain tip, just a couple little serrations in there. This is known as a dressing forceps. It's usually used to pick up dressings or maybe some very delicate tissue using this very delicate tip down here. But more commonly, when we're picking up tissue, such as skin, we're going to use the tissue Adson forceps. Now this forceps has a very tiny little tooth or set of teeth on the end. Kind of looks like rat teeth as they come together. So we call this the rat tooth Adson or the toothed Adson. And this is going to be used for picking up tissue. Those little teeth sort of grab that tissue and hold on nice and tight. And this here is an Adson brown forceps. Again, it's got that Adson shaped handle, but the tips actually have a series of teeth that can really grab on to some tougher tissue. Compare again the Adson handles to the plain handles. So I refer to these as plain forceps. We have again the dressing forceps, which just has a couple of serrations, versus the toothed forceps or the tissue forceps, which has the nice little teeth at the end, the little rat teeth. Often these are called the rat tooth forceps. But of course, different situations call for different forceps, so we have a variety of other forceps that we can choose from. One of the common ones is called the DeBakey. This is a very thin, narrow-tipped forceps with a very long handle. This is used usually for clamping blood vessels and things like that, very delicate tissues, so we can go in there and pick up that blood vessel or manipulate it in some way. Another forceps for delicate tissue would be the Singley forceps. This one has a wider, rounded tip, and it has a very small serration, so this is good for, this is an atraumatic forceps, so it's good for picking up very delicate tissue. We have two forceps here that look very similar. They have these big rat teeth on them. These are good for picking up very tough, heavy tissue, maybe bone or maybe some, tougher fascia or tendons or something like that. This one with the straighter handle is the Bonney forceps versus this one, which is a more rounded handle, almost looks like an Adson, only a very heavy-duty Adson. This is the Ferris Smith handle. And this forceps down here, this is known as the Russian forceps. It's got a ring of teeth around the outside, and it's got a little cup. Instead of a hole like the Singley has, it has a little cup in there, and sometimes that little cup can be used for holding specific tissue, like, say, a bone graft or something like that. Here we have some towel clamps. One of the more common is the Backhouse towel clamp. This one happens to have some very pointy tips on it, so just be careful with this one. This is used, all these towel clamps are used for clamping the towels together. As we drape around the incision site that we're going to make, we usually do so with towels, and then we will clamp these towels together. Now, the Backhouse, being that it is sharp, you can see how it is punctured all the way through that towel there. So this is a penetrating towel clamp, and once it's placed, you're not going to remove it because you're moving from unsterile, which is usually on the underside of the towel, to sterile, which is on the top side of the towel. So you don't want to remove that because you could be bringing contaminants back with it. So once you place this one, it's going to stay there in place, this penetrating towel clamp. Now, sometimes if you don't want it to penetrate quite so deeply and you want it to hold it in place, you can use the rotor towel clip, which is just like the Backhouse, only has these little balls on the end, which prevent it from clipping too deeply into the towel. It still penetrates, but it doesn't push all the way through. Those balls sort of prevent it from pushing all the way through. But sometimes you might not want to penetrate all the way through that towel, so they have non-penetrating or atraumatic towel clips as well, and you can use that to clamp on to a towel without actually penetrating through that towel. Next, we have a series of grasping forceps. Now, these forceps here come in all different tips, and in this case, a different length as well. This one is the Forester sponge stick. It's a nice long, kind of has the singly tip to it, but notice it has rings on the end, so they sort of clamp together, it latches together, that can hold things nice and tight. This one's also called a sponge stick, the Forester sponge stick, because we'll often wrap a Ray-Tac, a sponge, around the end that gives the surgeon something to dissect with, or maybe dab up some fluid, or maybe apply some gentle pressure if there's something bleeding. So we'll wrap this up with a little sponge, and we call this a sponge stick. Now, the next two instruments that we have are the Babcock and the Alice, and these are often shown together because they do very similar things but for slightly different tissue. Now, notice first that the handles are pretty much the same. The handles are the ringed instrument with a little ratchet on it that lets you clamp down on the tissue. Now, the tips of the Babcock has this nice sweeping curve, and then this long, gentle, straight point where the two ends meet, where the two ends come together. That is an atraumatic clamp. So what's happening is if you have some very delicate tissue, say a blood vessel or maybe some bowel, intestinal tissue, you can delicately grasp that with the Babcock and retract it or pull it away without damaging the tissue. As opposed to the Alice. The Alice has a tougher tip to it. It has teeth on it, and it's able to grab onto tougher material, say some fascia or maybe even some bone, and really hold on nice and tight to that tissue. This is known as a traumatic versus the atraumatic. Atraumatic, it's not going to damage the tissue very much. Traumatic, yeah, it's going to damage the tissue a little bit. So imagine this is you're going to use on tissue that you're going to leave in the body. This you might use on tissue that you're going to remove from the body. So this is going to give you a good, nice, tight grip on it to allow you to remove it from the body. So this is the Babcock, the atraumatic clamp, versus the Alice, the traumatic clamp. This is a much tougher clamp. Now, if you really want to grab onto something, you can use the Coker clamp, or the Ochsner clamp, as this is sometimes called. This is like a straight cryo, but it has a rat tooth at the end, so you can really grab onto tissue. This is often going to be used to pick up bone, or like little pieces of bone or something like that. You can get in there and pull those pieces of bone out with a Coker or an Ochsner clamp. Now, there is a larger version, a couple of different sizes. Again, this is the regular Coker, or the regular Ochsner, and this one, because it's the larger one, just like the Peen, I call it the Rochester Peen. This one is the Rochester Ochsner, the Rochester Coker. So the Rochester is the larger one, and then the regular Coker is the regular sized one. Now, the next set of instruments are known as retractors. These are going to be used to retract tissue out of the way, say retract the skin out of the way, hold that wound open so that the surgeon can see down inside and get to what the surgeon is actually working on. So these retractors are known as handheld retractors. The surgeon will insert it into the wound and place it where she wants it, and then give them to you, and you're going to hold them with your hands. So handheld retractors, you're going to use your hands to hold that wound open. This first one has a long tip on one end and a shorter tip on the other, and a little fenestration or a hole in the middle. This is the Army, Navy, or U.S. Army retractor. So you can think of it as Army, Navy, or Navy, Army, however you want to think about it. And this Army, Navy retractor is a very common retractor that you're going to see in many surgical setups. The next two retractors are very similar. They each have a curve on the end. One end you usually go into the wound, and that's going to pull against, say, the skin or something like that. And the other end, you can use your hand to sort of hold on and apply traction to that wound this way. This one here, this is known as a Parker retractor. It has a very simple retractor, just a piece of metal with a curve on each end. If you put it down, it kind of looks like a park bench. This is how I remember the name of this one. So a Parker retractor looks like a park bench, whereas this one is known as a Goulet retractor. Now this is French, it's elegant, it's got all these fancy curves to it. So just like the Parker, which is just kind of, you know, a piece of metal, looks like a park bench, this one's a Goulet. This is French, it's fancy. So that's how I would tell the difference between these two different types of retractors. Now the next couple of retractors are known as Sen retractors. Now notice the ends are slightly different. One end has a claw, one end sort of has this little bent tongue kind of thing coming down from it, and the other one looks the same way. Now notice the claws on these two retractors. One is very sharp, has very sharp tips, and the other one's very dull. And you want to make sure that you're aware of what you have and what you're passing to the surgeon, because there is a significant difference. The sharp one is indeed very, very sharp. It will almost invariably grab gloves or your gown or all kinds of things. These things like to really grab onto a lot of stuff, so you got to be very careful with these. These I don't pass very often. And when the surgeon asks for a Sen, they're usually not going to specify whether they want the dull one or the sharp one. 95% of the time, they're going to want the dull Sen, and I'm going to assume when they ask for a Sen, they're going to want the dull Sen because it's a lot safer. Only if the surgeon specifically says, I want the sharp Sen, or when I pass the dull Sen and they pass it back saying, no, I want the sharp one, will I pass the sharp Sen. Because the sharp Sen will grab onto just about everything and it can cut you, so we really want to use that very sparingly. So whenever the surgeon asks for a Sen, doesn't specify which, I hand the dull Sen. Another very sharp-tipped retractor, this is the Joseph skin hook. This is used often, say, in plastic surgery or other very delicate tissue. It's got a very fine tip on it. It's a very sharp tip. That very sharp tip will allow it to grab onto some delicate skin and hold it exactly where the surgeon wants it. Now, all of these retractors so far are handheld retractors, meaning you're going to hold them in your hand and you're going to sit there and hold them to hold that wound open as the surgeon's doing the procedure. But sometimes in order to keep your hands free or to keep your hands out of the way of the surgeon, you can use a self-retaining retractor. And this one is a Wheatlander retractor. And it's got a special little grip on it that allows you to go in, place it into the wound. The surgeon will place it into the wound, retract it open, and then it will lock into place. It'll hold open. So it's keeping itself open. It's self-retaining. So that's why it's called a self-retaining retractor. And this one in particular is a Wheatlander style self-retaining retractor. But if none of these retractors work for you or work for your surgeon, sometimes you can just get a strip of metal. This is known as a malleable retractor. This is kind of cool because what you can do with this is you can just shape it to whatever shape you want. So now I've got a nice big curve, or maybe I want a nice tight curve, or maybe I want it to be nice and shallow, something like this. So I can shape this malleable retractor to any shape that I want. And these come in nice and wide like this, or maybe some nice narrow strips, kind of like your Parker. And you can again shape them into whatever shape you want to retract whatever specific wound you've created. Now, oftentimes in the wound, some fluid will gather in there. It could be maybe some blood or maybe some irrigation that we put in there to sort of wash the wound out a little bit. So we have a couple of different style suction tips that we can place on the suction, the tube that runs off to the canister and then onto the wall. So the first style of suction tip, this is known as a Fraser suction tip. You're going to attach the suction tube to this end. This one has a little stylet in here. This is going to be used to clean it out. Sometimes some tissue or other stuff can get stuck inside of this, so you can use this to clean it out. It doesn't work very well, but you can try to use that. You can pull that out. You attach the suction to this end and then use this tip to suck up any little areas of moisture or fluid that might be in that wound. These suctions have a little hole here that the surgeon can use to cover that up to control the strength of the suction with the hole open. The suction is a little weaker. Cover that opening. Most of the air is now coming in through that tip, makes it a little bit stronger suction. Now, because of the stylet, the Fraser suction is usually counted as 2 pieces, so make sure you count both pieces when you're counting your instruments. Our next instruments are the Yankauer suction. Yankauer is how you pronounce this. We have the plastic version, which is disposable. You use it once and throw it away. Or you have the metal version, which can be cleaned and re-sterilized and reused. The metal version has a tip that unscrews. This is done during the sterilization process. And you want to, because it has 2 pieces, you're going to count this one again as 2 pieces. It'll be 2 pieces in your count. So this one will be 2 pieces in your count, whereas the plastic one, this is just 1 piece. The metal tip doesn't come off because you don't have to clean it. You can just throw it away. Now, these rounded tips on the Yankauer suction are a little bit different from your Fraser in that if some tissue gets stuck in the one end, there's some holes in the side that can take the suction away from that and not draw that and really damage that tissue into the suction too far. So these rounded tips help protect the tissue. Now, speaking of protecting the tissue, we have this next set of suction, which is the pool suction. Now, this has a nice deep suction probe that has a lot of little holes in it. This is going to be used, for example, inside the abdomen. You create a nice big wound into the abdomen. It starts to fill up with some fluid, some irrigation most likely, and you want to suck that up. Well, you can do that by putting this suction tip into that pool of blood or pool of irrigation. So that's the pool suction. That's how I remember the name. But because there's so many little holes along the side, it's not going to suck up and damage any tissue, very delicate tissue like the intestines that might be in that area. So it's going to be a nice delicate suction that you can place into the abdomen. We have the disposable version, use it once and throw it away, or the reusable metal version that can be re-sterilized. Again, the metal version also comes in 2 pieces, so you want to make sure you want to count these 2 pieces. And the last type of instruments we're going to talk about are going to be our needle holders. These are going to be used for holding suture needle, allowing us to pass that suture very carefully through the tissue where we want to do so. And we have a couple of different styles here. Now, the 2 most common types of needle drivers are going to be your Cryowood driver, which is going to have more of a fine tip to it. It's going to be for more delicate suturing, whereas the Mayo Hagar is a more heavy-duty type of needle driver. You can grab onto larger suture needles and really pull them through some tough tissues with these. Another type of needle driver is the Ryder needle driver. This is a very fine tip. It's a very narrow tip. You can sort of see how narrow that tip is there. That allows you to grab onto some smaller needles as you pull them through the tissue. And down here at the end, the smallest needle holder that I have, this is known as the Webster needle holder. It's a small, delicate needle holder used for holding small and delicate needles. So did you get all this? There's a lot going on here. About 50 or so instruments we covered in a very short period of time. It's going to take a long time to memorize all of these and the many more that you're going to have to learn as you go through your surgical technology career. If you want help, I've got a PowerPoint of all of these instruments that I've just covered. It's down in the link below. You can download that and help study and review some of the instruments that I've just discussed.